Hello, this is Sean, partner and consultant at the Care Partnership, and this is a quick overview for our training for care staff guide that you'll see below. Training is a big question that we get from all of our customers. How do I train staff? What sort of training do they need? When do they need training? What are the requirements? So this blog post or this sort of guide aims to provide you all the information you need to know about training care staff. Care staff, as when they join your organization, will all need to go through mandatory training. You'll need to make sure they've got this in place and it's refreshed once a year. This is a requirement of CQC, but also just best practice, even if you're not CQC registered. So make sure staff have completed training as part of an induction, but also then complete it once a year as a refresher. So there are really three different options when it comes to training. You can get an external trainer to come in to your office. So you can set one training day each month where you schedule it in. You recruit staff throughout the month. So you have interviews and get contracts signed within the month, and then book them onto a training at one set date each month. At this point, you get a trainer to come in for one day and deliver the training to a group of staff so you can get them fully signed off and ready to work. The other option is to deliver the training yourself. So if you have a train the trainer course, or you've got someone who has experience in training staff and the right certificates and qualifications, then you can deliver the training yourself on them once a month training days. The other option is to send staff out to a training centre. So there are lots of training providers across the country where you can send staff for 1 or 2 days to go through all the mandatory training and get fully signed off. So that's another option if you don't have the facilities to be able to deliver the training in-house. You can offer e-learning. So that's a big question we get is around the e-learning. Although there are some mandatory training modules that have a practical element, so they can't be fully signed off until they've done a practical training. So the two that it includes are basic life support. So physical CPR, learning how to do that in person is very important. You can't just learn it from a video. So that needs to be done in person, as well as moving and handling. So actually getting physically hands-on with equipment and learning how to use certain equipment for moving and handling. That's important. That is done in person as a practical training. But you can offer like a blended approach. So you can do lots of the learning online with the two practical elements separately, either in your office using one of the options we've suggested, or sending them out to a training provider. So yeah, this blog post has lots of information about the sort of training that staff need to complete and the different options. If you do have any questions around training, however, get in touch and we'll do our best to help.